Hello everyone, this is Dr. Rahman from District Endocrine, and today we have our guest Kelly Powell. She's a certified diabetes educator, and today we are going to talk about CGM technology. All right, Kelly, so let's talk about different kind of CGMs today.
Great. CGM has been one of the best inventions in all the years that I've been working in diabetes. It's really helpful for the individual as well as for the healthcare team. As you know, when you have the report on an individual of what their blood sugars are doing day and night, it makes such a big difference for you to be able to change their medication appropriately.
Mm-hmm. Yeah. So CGM is more like a movie rather than a picture. Like when you're comparing it to finger sticks, which is just giving you one set of information, CGM is providing you continuous glucose monitoring, and the devices check your sugars every 5 minutes. So they are really beneficial in terms of understanding how your glucose control is.
Yeah, the patients really like it. I know when you've had patients and you put them on CGM and they come back and talk to me and say, I had no idea that's what pizza did to my blood sugar, or I didn't know that little piece of cake was going to affect me so much. So getting that real-time data and an immediate response to what that food did, or maybe on the other hand, what that walk did, or cutting the grass, how their blood sugars drop when they're active and they feel that immediate reward for their efforts.
True. All right. Well, so there are different components on the CGM, and we are going to talk about those today. So let's start from the sensors.
Okay, so the three components that are the same for all the different sensors are the sensors themselves, the transmitters, which of course every sensor has their own transmitter, and then the receivers, what's receiving the information and giving a picture to the patient all the time of what their blood sugar's doing. So I brought a couple of samples so that we could look at the different ones, and don't mind the specifics, but three of them are self-injected at home by the patient, and one is actually implanted. Right now it's FDA approved for 3 months. It's just a small little incision.
This is very small.
Very small, placed underneath the skin. In fact, you don't even need stitches. It's just like a butterfly to close it up. And then this transmitter is going to be placed on top of the sensor outside of the skin. And that tape over it, and they'll charge that up every day and change that tape. But that lasts 3 months for that one insertion.
Right, and right now the company is also trying to get another for 6 months approval, right?
Yes, it's
yeah, so that's underway. And this is from a company called Eversense, and so this is more implantable. There is a procedure that is done by a doctor, and they place it under your skin, and the sensor sends it to transmitter, and then you can have the information on your cell phone device, and you can monitor, and you can share that information with your physician, and they can look at your blood sugars and manage them. Now this system is very different than the other kind of systems available. So we have other sort of systems such as Dexcom, G6, G5, and there are older models too. So what that does is we have this small device. This goes into your skin, and it's a very fine filament kind of thing. It's not like a really needle. It's just like a filament that goes into your skin and gets blood sugar checked in your subcutaneous tissue, and then we have this transmitter that is going to transmit it to the receiver. Or in some cases the receiver can be your cell phone. In some of these like Freestyle Libre offers you to have the information transmitted to your cell phone, and then you can share it with your physician, or you can look at it and see what consequences are happening from your diet and lifestyle.
And another really great thing about CGMS now is you can also share it with someone else. So maybe the parent of a child, if they're away at school, or at the babysitters, or at a sleepover, the comfort of knowing I can just look at my phone and see what's going on. So that's nice, that sharing feature. So the other ones, as you mentioned, we have the Dexcom, we have the Medtronic Guardian Connect. That's a sensor inserted The needle is retrieved, and the little filament stays underneath the skin and reads that interstitial fluid. And this is the little attached transmitter. I saved this one for last, the Freestyle Libre, to show you actually how to insert, and they're all very similar, very easy to do at home. So there's the inserter and the sensor, and you just clean, let it dry, and place. One of the nice things about the Freestyle Libre is it is the sensor and the transmitter all together in one piece. But that's what the patient does. They're all different amounts of time, but the 2-week Freestyle Libre, they place that, and that's it for 2 weeks. They have one insertion.
And the good thing is it's just like a small coin, basically, like a quarter. So it looks nice and gives you real-time information about your sugars. So the best benefit what I have seen with patients is that they don't have to poke their fingers 5 times a day or 4 times a day. So it makes your life much simpler. You just put it there, like this sensor, you put it for 14 days and you're good with that. So those are the benefits of this new technology.
Right. I also like that when it sends the information to your receiver, you can see the trend. Because there's a big difference in someone whose blood sugar is 105. That's decent, right? Most people would really like that. Or 105 and dropping fast.
Right.
And I have nothing with me to treat a low blood sugar, and I'm stuck on the other side of a train. So all of those things add up and really give information to help the person manage better.
Right. So one thing is it not only lets you know that you are going to go high, or also it lets you know that you're going to drop. So there are different alarms that you can set on, and different at what sugar you want to be, reminded of that you are going to drop. For example, if you're sleeping and your sugar is trending down overnight, there is a built-in alarm, and then it's going to alarm you and wake you up, so that you don't stay on a very low sugar for a longer duration of time.
Right.
So now when you have an alarm built in, it will wake you up and you're going to fix your sugar. So that's the really important benefit, especially if someone who has hypoglycemia unawareness. That means that they have low sugars and their body is unable to feel that they are having low blood sugar. So that's a dangerous territory that we are heading into.
True.
So sometimes these patients can be found unresponsive. So that can be life-threatening. It can precipitate into a heart attack or cause seizure or permanent cognitive or brain damage, basically. So this new technology is extremely good. And another good thing about this technology is that some of these the CGM devices can actually connect to insulin pumps, and they can help the delivery of the insulin pump.
Yes.
So that's a really good one. Very good benefit with the Dexcom, Guardian, and different sensors, that they can actually talk to your insulin pump. So
right, and even help change the dose. If your blood sugar is going too high, they can increase. If it's going too low, they can back off on delivery. So as I said, the invention of continuous glucose monitor has been one of the very best things to happen to diabetes, for sure.
True. That's really true. Thank you so much, everyone, for watching today's District Endocrine video. This is a disclaimer that this episode is not sponsored by any of the pharmaceutical companies. This is just for patient education. Thank you so much for watching this video, and please don't forget to subscribe this channel.